Hi, and welcome to And So Much More. I'm your host, Cami Smith, and we are in a bit of a different space. We are over at our Centra College in a beautiful studio that they've allowed us to film in, and we're having a conversation that's very timely for Heart Month. We're going to talk about heart failure and what it looks like to live with that as a diagnosis, but then also put some definition and education around that for those of you who are listening. And so we can bring awareness to this type of diagnosis during Heart Month. So I am here with MaryAnne Poling, and she is a clinical cardiac navigator or cardiac clinical navigator. Is that correct?
Correct.
Okay, make sure I'm getting that right. And then we also have Dr. Junpaparp, who is cardiologist over at Heart and Vascular Institute. And then we have one of our patients, Ken Mueller, and he has very graciously allowed us to bring him in to just share his side of what his story has looked like as he's lived with this diagnosis. And so as we're kind of elusively referring to diagnosis over and over again, let's put some definition around that. So how would you define, Dr. Junpaparp, how would you define heart failure?
So the heart failure is a condition that the heart cannot keep up with the supply and demand of the body. So when the heart is not in the right functions, it cannot circulating the blood well. And a lot of patients will feel tired easily when they try to do things, and sometimes getting more short of breath. And as the condition progresses, they may start retaining fluid and have some swelling in other parts of the body, like legs or stomach.
Okay. So is there typically like a catalyst for this, or are there things that lead to heart failure?
Yes. The most common cause of heart failure is actually high blood pressure and a coronary heart disease, which is basically a blockage of heart arteries that make the heart cannot get the nutrient or oxygen. Other than that, there's some other cause like leaky heart valve, other reason to directly damage the heart, such as viral infections that cause myocarditis or inflammation of muscles. Some toxins such as alcohol, too much alcohol can damage the heart, or other substance use like cocaine can damage the heart, and other rare conditions that like congenital conditions or any genetic driven.
So some of the things you talked about, like shortness of breath, and what are some other symptoms that if someone is maybe considering or they're experiencing and they're like, what should I do? How do I know that this is what's happening, and where do I go?
Right, that's a very good question, because all short of breath is not always from heart failure. Commonly, patient can have COPD, emphysema, or asthma, leading to short of breath, or even anemia can cause shortness of breath. So the heart failure is a diagnosis that need both clinical assessments and some investigations. So we can use some blood work that can show a marker of heart failure. We can do an electrocardiogram to look for abnormal rhythm. And most importantly, we do an echocardiogram, which is sonogram of the heart, that can let us see how the heart is squeezing, and look at the other structure inside the heart, like a heart valve, to see if there's any narrowing or any leakiness, or if there's any evidence of heart attack that we can see from the scar that can visualize on the echo. And usually then we'll add more investigation based on the finding, whether patient need to be look into blockages by a heart cath, for example.
So we've had a lot of conversation lately on a lot of our channels at Centra about where to go for different types of emergencies. And so for someone who is experiencing something that they are believed to be in line with this is an emergency care visit, correct? Like, this isn't a go to your urgent care and see how you're doing, or what would you suggest?
So it's dependent on how bad is the situation. A lot of times, if they just have short of breath when they walk or exerting, is not yet that emergency. Certainly they can either see the doctor or refer to cardiologist for further workup. But if it's come to the point that they're very congested, which means they have pretty advanced symptoms, like it's fluid retaining, can't breathe, just talking, and cannot do any activities at all, definitely that need to be evaluated in the emergency room, and perhaps hospitalized, which is going to make it faster to get diagnosis than the outpatient world.
Yes, absolutely. So what are some treatments if this is a diagnosis you receive?
Mostly, if they are congested, the first thing is to decongest by having them take the water pills or diuretics that will get rid of fluid for them. And then based on what type of heart failure, because we have a type of heart failure that's weak pump and stiff pump. The weak pump, we have more of drugs that can help strengthen it up.
Okay.
There are many kind actually. And other than that, we look for a course, like I mentioned earlier. Fix the course is important, like putting a stent in if they have blockages, fixing the leaky heart valve if there's any, and stop drinking alcohol or using any drugs that might make the heart weak. And ultimately, lifestyle change is also important, and that's why we have our CHF navigators or nurse to help educate them and let them know what's to avoid and how to live with heart failure.
Yeah, and I'm glad that you mentioned the cardiac clinical navigator, because what I would like to ask is, what does it look like to live like this? What does it look like from diagnosis to treatment to this is a lifestyle now? And then what role do you play in that?
So when the patient is in the hospital, a lot of times I come alongside them as the navigator and do some education with the patient and with the family to tell them, what it's going to look like, what type of lifestyle changes they need to do with medication, and if they can't afford those medications, what type of assistance that we can do in the office to help them afford those, and what type of foods that they need to be aware of, and what type of foods that they need to start eating.
Okay.
And what type of activities they need to start incorporating, and helping them communicate with the office, the cardiology office, and with our navigators there. They work really hard to continue the care that we start in the hospital, our navigators there. So it's about communicating with the office. And also, as navigators, we really advocate for the patients and help communicate with other people in the team. If the patients really have a struggle with transportation or with some other issue, we communicate with them, or we help them get other types of assistance.
Okay. So you are like advocate and partner with these patients as they're moving forward.
Yes, and hugely try to educate them too. So that they feel like they have that emotional support. Because it can be kind of hard, but the biggest thing that we try to convey to the patient, your heart isn't stopped. This isn't a death sentence. We're here for you.
Yeah, and I think that is so important, because whenever it comes to illness, diagnosis of your heart, I mean, that just feels so heavy. It feels so crucial to just life. And so to have someone there walking beside you to just help you understand and see what your options are, that's got to be huge. Is this for inpatient and outpatient? How long does that relationship continue?
It continues throughout the disease process. So inpatient, I am the heart failure navigator along with my other partner, Lynn Mays. And then we also have several inpatient or outpatient clinical navigators too. Desiree Mays, Sarah Landon, and Jacqueline, and they work extremely hard on our team, along with other people in the clinic. They all work and get to know our patients and have a very close relationship.
As an outpatient, we try to empower patients who left the hospital, that they can help managing their symptoms and they can do things to make they feel better. We told them what symptoms to look for, how do they, for example, weigh themselves every day. If they start to retaining fluid, that will show on their weight gain. And if that happen, they can contact our office directly, and we can tell them on the phone of what to do. And this is very common, and this is the best way to keep them outside of the hospital, because we know every time they go back in the hospital, that means they can get sicker.
Yes. So wow, this is such a partnership. There's got to be so much communication that's absolutely necessary to do this well. So it obviously takes a team.
It is.
And I want to kind of transition to you, Ken, because you've experienced all of this. And so you were diagnosed 5 years ago now, and have over 5 years ago now.
5.5 years.
So, and you have lived long past your original diagnosis, which is incredible. But why don't you share a little bit about your journey with us, starting in that diagnosis in 2019?
Well, I was at work, and I was feeling kind of weird and everything, and I got dizzy, and that's pretty much the last I remember. I drove myself home.
Oh, wow.
And then I called my doctor, and he told me to get right to the emergency room, and they did a, what do you call it?
Cath.
Yeah, a cart cath on me, and they couldn't get it. It was blocked. They couldn't get all the way up.
Oh, wow.
And so then they sent me to Lynchburg General, and when I talked to the surgeon, he didn't want to do the surgery. They couldn't do it, I guess. So then Dr. Renison, who was my doctor at the time, he connected with Duke University.
Okay.
And I went down there, and I talked to the surgeon down there, and gave me pretty final notice to make my mind up, or that was it. So I went ahead and done it, and I have not regretted a day of it.
Yes. So he gave you, I think you shared earlier, 6 months, correct?
6 months, yes.
And so I'm sure that played a pretty large role in your, let's do what we need to do.
Right.
So here we are, a lot longer than 6 months later. How are you feeling? How are you doing? What is it like to live with this?
Well, it's a little bit of a change, of course, you know.
Of course, yeah.
I live with batteries during the day, and then I get plugged in to an outlet at night. And it's the adjusting of making sure that you remember to change your batteries, which I forgot a couple times.
Oh, wow.
And that gets kind of scary, but I do carry, what do they call that bag?
A controller.
In the bag and everything.
The backup controller.
Yeah, backup controller, and I carry 4 sets of extra batteries with me at all times. I got them right in the car there.
I just want to add that what they did surgery at Duke is to implant a left ventricular assisted device.
Oh, okay.
Which is basically an artificial heart pump. Back then, Ken's heart was very weak, and they could not do a bypass surgery for the blockage because it's too risky.
Yeah.
So instead of that, they offer the artificial pump, which basically replaced the heart function completely on the left ventricle, which Ken's problem was.
Yeah.
So that's why he has this control and battery that run the pump internally. And he has some drive-by side that has to be cared and cleaned every day by the nurse. So it's a lot of lifestyle change, honestly, but it's some things that technology has helped patients live longer. From 5 years from 6 months of life expectancy, and now he's been here for 5 years and still doing very well. Yes.
And I was told that I had every artery blocked from 60 to 100%.
Oh my. Wow. I mean, can you remember, because I know this was quite a long time ago, but can you remember how you feel now compared to how you felt then with that type of blockage in your body?
Better.
Yes.
Much better, when I think about it, because I wasn't able to really navigate at all.
Yeah.
But I didn't realize it at the time.
Yeah.
So what would you say to people who are listening who are just kind of feeling how you felt a little bit over 5 years ago, where you said you just didn't feel right, you knew something was wrong?
what level of attention did you have to give yourself? Like, how would you advise someone who maybe is kind of right where you were?
My advice would be, if you start feeling any symptoms like that, the dizziness or anything, get right to the doctor.
Yeah.
Emergency room.
So often we push things down.
Yeah. And I did for a while.
Yeah.
You know?
Wow.
I was thinking it was something else. I got diabetes, so I was figuring it was diabetes.
Oh, wow.
Putting the blame on something else.
Yeah, no, and that's so easy to do. It's so easy, I think, especially with how busy we all are right now, just to push things down, to justify it away. And that relationship with your physician is so important for them to even know, but especially talking with you. Yeah.
Right here. She's the best of the best.
I love that. So what has that relationship now for like the continuum of care that you're receiving here at Centra? What does that look like for all of you?
Perfect. That's all I can say. I mean, I got a fantastic nurse that comes out, to change my bandage and that there. She's a pleasure.
Aw.
And when she's out there, if she can help me do anything else, she's always willing to do it.
Oh, yes. Yeah.
No, she's fantastic.
Yeah, well, I mean, Ken has this LVAD, so he still have to follow up once or twice a year at Duke. But we do a share care, meaning that we also alternate the visit. So I see Ken every 3 months in alternate, so that way he doesn't have to drive all the way down, which is 3 hours drive from his house. And we have frequent blood work that we have to check, monitoring the pump.
Okay.
And most patient will need to stay on blood thinner, for example, but unless they have bleeding, that's we have to cut back or stop it. But other than that, a lot of our LVAD patients can live a pretty good normal life.
Yeah.
This is for mostly advanced heart failure patients, but not every heart failure patient will need to have this pump put in. A lot of them that has milder symptoms, they can just manage with medication.
Yes. And so moving forward, how do you advise patients? Because it's obvious lifestyle changes, but it's also taking care of yourself in a very different way. So what are some of those guidelines or things they have to adhere to that you share?
So, for those who don't have any heart problem, I would say prevention is the best way. What you can do is basically live a healthy lifestyle. Basically exercise every 3 or 4 times a week, 30 to 40 minutes at a time. Eat a healthy diet. If you have any medical problems such as diabetes, high blood pressure, high cholesterol, make sure you get them under control.
Yes.
And that's all you can do. Don't smoke and don't drink too much. Basically, good healthy habits. And sometimes you can control things like aging, genetic-driven, or viral infections. And if somehow you have heart failure symptoms, just follow up with a heart failure team and take medication right and change your lifestyle again and again.
Yeah.
That's all we can do to help prevent the disease, and at least if you have disease, prevent it from progressing.
Yes.
That is one of the big things, to make sure you take your medicine right.
Yes.
And
yes.
on the time that you're supposed to take it, because different things can happen if you don't. I know that.
Absolutely. Well, and especially when I think about your situation, like you have to be very keenly aware of like the battery life you have going on, the time you need to take medication. And so you have to be feeling well to be able to do those things.
Exactly.
And so in allowing and really honoring yourself, I think, in taking care is the best way to really do that. Set yourself up for success.
Yes.
And I think too, going to a yearly checkup, catching things early.
Yes.
So that way, we can catch things so early. And, sometimes it's just a minor little thing we can treat.
Yeah. And I love that you said that, because we always come back to have a good relationship with a primary care provider. It is so important. Somebody who knows you, who sees you year after year, who has seen how your blood work has, fluctuated, and it's so important. And so when conversations like this happen, when you're feeling something different, or you can put a finger on it and get sent to the proper places, because it's all connected. I think when you think of, so many people think that, if you're sick, you go here. If you have heart, you go here. having a relationship with your primary care can ensure that you are directed to the right places because it's a large system working together. And so I think that's a really good point.
Yeah, and most of the patients that I go to teach will tell me that for months and months, their socks were tight from the fluid, and they didn't go and speak to their doctor. They just thought it was a normal part of aging. They thought they were just getting out of shape from the shortness of breath.
Yeah.
So, don't be afraid to go and talk to your doctor. Sometimes it is getting out of shape or other things, but it doesn't hurt to talk to them.
Yeah. Ken, I see you nodding out of the corner of my eye.
No, I agree with her.
Are there some of those things in hindsight that you are experiencing that you kind of think back and why did I not notice that or pay attention to that? Or
Well, like I said, a lot of things I blamed on something else, and
Yeah.
I figured I had the diabetes under control when I really didn't.
yeah,
And you always want to put the blame on something else.
it's true. It's true.
I was pretty good at that for a while.
Well, thanks to your team, you don't have to do that anymore.
No. I mean, and I've called Dr. June during hours that she wasn't working because I was worried about something,
Yeah,
And
yeah.
she's always been there, always.
Oh, I love hearing that.
It's been great. And like I said, it's the same way with my nurse too.
Yeah.
So all in all, when you combine all that together, I'm pretty lucky.
Yeah.
Pretty darn lucky.
Yeah. Well, we're glad that you're here.
Yeah.
Is there anything I haven't asked you guys that you feel would be important to mention or include?
I think just don't be afraid of the word heart failure. It's just another disease that can be managed.
Yeah.
That's right. I think I could not agree more with that. I mean, and last but not least, we like patient to thrive, but not just to live, but to thrive. So even though you have heart failure, doesn't mean that your heart gonna fail further.
Yeah.
We can stabilize the way it is, or we can make it improving.
Yeah.
If you take medicine right, do the best you can with the lifestyle changes, things can get better.
Yeah. I love that. I think that's a great place to end. Thank you guys so much. I appreciate your insight, and then also, Ken, you being willing to share your experience.
More than welcome.
And thank you all for joining us on And So Much More.